Imagine a world without babysitting. Seriously, close your eyes and try to imagine it. Can I ask you a question? Do you know what abortion is? An abortion is basically a termination of a pregnancy. There are 5 types, and they are all legal here in the United States. The first type is a medical abortion is performed through taking 2 medications in a pill form. A methotrexate is the abortion method you can use in the first 7 weeks. The third form is a vacuum aspiration is done during the first 12 weeks to 16 weeks of pregnancy. The fourth is called dilation and evacuation. It's an abortion procedure that is used in the second trimester, usually a trusted source that is done after the 14th week of pregnancy. Last but not least, an introduction abortion is done in the second trimester of pregnancy and may be an option if you're past the 24th week of pregnancy and can no longer get a procedure. In many countries and different cultures, there is a rich history that women came together to help each other abort. Until the late 1800s, women healers in the Western Europe and the United States provided abortions and trained women to do so without legal prohibitions. As scientific methods began to dominate medical practice and technologies were developed to prevent infection, medical care overall became much safer and more effective. But by this time, many women who needed abortions had no choice but get them from illegal practitioners. Without these medical advances at their disposal, the back alley abortion remained dangerous off a deadly procedure while legal areas of sanctioned medicine improved dramatically. Many women died or suffered serious medical problems after attempting to self-induce their abortions or going to untrained practitioners who perform abortions with primitive methods or unsanitary conditions. During this time, hospital emergency room staff treated thousands of women who either died or were suffering terrible effects of abortions provided without adequate skill and care. One of the abortion methods, which is the pill form, which they don't tell you after you take the pill, a lot of women, I read in an article, 2 out of 5 women that have did the pill form, they are in the bathroom and they are seriously cramping or in pain, and the fetus comes out of them in a blood clot. Abortion became a crime and a sin for several reasons. A trend of humanitarian reform in the mid-19th century brought in liberal support for criminalization because at that time abortion was a dangerous procedure done with crude methods, few antiseptics, and high mortality rates. But this alone cannot explain the attack on abortions. For instance, other risky surgical techniques were considered necessary for people's health and welfare were not prohibited. Protecting women from dangers of abortion were meant to control them and restrict them to their traditional childbearing role. 5% of them only had access in cases of rape, incest, or life endangerment. In the 1960s, inspired by civil rights and anti-war movements, women began to fight more actively for their rights. The fast-growing women movement took the taboo of subject of abortion of the public. Rage, pain, and fear burst into demonstration and speak out as women burdened by years of secrecy got up in front of strangers and talked about their illegal abortions. Women marched, rallied, and lobbied for abortion on demand. Civil liberties groups and liberal clergy grouped in efforts to support these women. Preventing women and girls from accessing an abortion does not mean they stop needing one. This is why attempts to ban and restrict abortions do nothing but reduce numbers of abortions. It only forces people to seek out unsafe abortions. Forcing someone to carry on an unwanted pregnancy or forcing them to seek out abortion, an unsafe abortion, is a violation of their human rights, including the rights of privacy and bodily autonomy. The information that I have given you today, I don't want you to take it and think that women are trying to kill something that you think is so precious. When dealing with abortion rights, it's not about the person carrying the unborn fetus, but it's about how you take the information I have provided with you today and utilize it in your everyday life.